Good afternoon, everyone, and welcome to our session, Human Service Partnerships to Advance Health in Arizona. My name is Carla Berg with Blue Cross Blue Shield of Arizona, and I'm honored to be here today for this Arizona Community Grand Rounds. Before we begin, I'd like to thank our planning committee, the NARBA Institute, and those behind the scenes making this event possible. Today's session is part of our ongoing commitment towards advancing health and well-being and bringing together community partners to share knowledge and inspire action. We're joined today by experts from the Maricopa County Human Services Department and Central Arizona Shelter Services, who will share insights into how partnerships are driving innovative solutions for homelessness and health in our community. I'm honored to share some brief bios for each of our speakers today. KateLynn Dean is a dedicated social services professional with over a decade of experience focused on homelessness, housing, and trauma-informed care. As the Homeless Initiatives Program Manager for Maricopa County Human Services Department, she leads efforts to improve outreach, streamline resources, and foster partnerships to support vulnerable individuals and families. Previously, she directed community and youth services at Homeward Bound, launching prevention and youth services and programs. Her career began in advocacy and crisis response for survivors of sexual and domestic violence, and she has consistently blended direct service, leadership, and systems change. She is driven by compassion, collaboration, and a commitment to building pathways to stability and hope for all. Gina Brockdorff. Since May 2023, Gina has been the program coordinator for the Maricopa County Homeless Initiatives Division, where she strengthens partnerships and standardizes street outreach services for individuals experiencing homelessness. Her career in homeless services began in 2007 at Central Arizona Shelter Services, evolving from shelter intake worker to case manager and later to a house-based case manager, contributing to key community projects. Driven by a desire to make a tangible impact, Gina finds daily motivation in her family and the knowledge that her work improves lives across the community. A standout experience in her current role was collaborating with local agencies to connect with people living in remote encampments, highlighting her commitment to meeting individuals where they are and driving meaningful change. Nathan Smith is the Chief Executive Officer at the Central Arizona Shelter Services. He is a dedicated nonprofit executive leading and expanding programs in homelessness and behavioral health. Nathan brings a wealth of experience in strategic leadership, program development, and fiscal management. He worked at the Phoenix Rescue Mission for 10 years, where he served as the Chief Program Officer, and his career highlights include significantly growing homeless outreach initiatives, scaling residential behavioral health programs, and establishing private and public partnerships. Brittnie Stanton is the Chief Program Officer at the Central Arizona Shelter Services, where they lead and integrate all programmatic operations, including emergency shelter, supportive housing, and behavioral health services. With over a decade of experience in nonprofit and social services across Arizona, Brittnie has developed and implemented innovative case management models, overseen multi-million-dollar program budgets, and cultivated strong partnerships with funders, government agencies, and community organizations. Brittnie's leadership has driven program growth, compliance, and improved service delivery, and experience spans strategic planning, staff development, and outcomes evaluation. Next slide, please. And one more. I would like to note that all planners and speakers of this training have no relevant financial relationship to disclose. At the end of our session, I will provide details for continuing education credit certificates for attendees. With that, we will get right to our speaker presentations, starting with KateLynn and Gina. Thank you.
Thanks, Carla. All right, hello everyone. So I mostly am going to pass it off to Gina and just jump in as needed whenever there's just further clarification on anything. But today we're just going to walk you through what our hand-in-hand street outreach services program looks like. And you'll get to hear a lot more about what it looks like, how we do it, who we work with, and then how you can utilize this as a resource for anyone who you might come in contact who qualifies for our services as well. And so we'll get into what that eligibility criteria is and how to make sure a referral happens and what that looks like. So I'll pass it over to Gina.
Awesome. Thank you so much, Caitlin, and thank you, Carla, for the introductions. I'm super happy to be here. So let's just jump right in. These photos are representative of the amazing individuals that we have on our team. These are our CBI street outreach staff in the field, working in the river bottoms. And we chose these photos because it really, I think, encompasses the compassion that the team has for the work that they do, animals included, as you see in that photo there. So we partner with two separate agencies. One is Community Bridges Inc. and the other is Phoenix Rescue Mission in order to cover a wide spread of the valley within Maricopa County. So just to give an overview, this is our coverage area for the Hand in Hand Street Outreach Program. So our focus is on smaller cities and towns with a population of less than 200,000 individuals. We also do cover county islands within Maricopa County. So just, you know, even if it's not within our service area, if it is a county island within a non-service area, we will still respond to that, those calls. We have 5 cities that we have invested partnerships, meaning we have intergovernmental agreements with those cities, or we do have funds coming into the county in order to provide the services within those areas. And those 5 cities right now are Peoria, El Mirage, Surprise, and most recently Goodyear and Tolleson. So this is our fiscal year 25 wrap up. So we were able to show how many individuals we served from outreach. So 2,242 individuals. And of those individuals, 78% of them were engaged with case management or other services that our program ties folks to. We have an 86% response rate within 24 hours. And sometimes that shifts a little bit. That's our goal. Our focus is to respond to all outreach calls within 24 hours. However, sometimes that can get bogged down a bit based on the amount of referrals that are coming in, but we do our best to stay at that 24-hour response time. We were able to get 413 individuals into shelter, alternative treatment or alternative housing or treatment centers. And the average amount of money that we're spending on individuals or households was about $2,600. And that is speaking directly to a flexible funding component that we have tied to our street outreach program, meaning that we have up to $3,200 per person or per household that we can help remove any barriers that somebody might be experiencing. That could be, you know, rental arrears, that could be, you know, an old utility bill. Maybe it's just the cost of moving into a place, right? Because sometimes it's that deposit plus first month's rent and any other concession fees. So this really just helps remove those barriers that folks are experiencing with folks that they're encountering on the streets. And so we spent a grand total of $296,943. That's our deposits and move-in assistance combined. Within that flexible funding component, we're also able to assist individuals with car repairs in order for folks to stay employed. As we all know, public transportation is very limited, especially in the West Valley area. So helping folks with car repairs in order to maintain their employment is huge. We help individuals get IDs, and then also we can assist with emergency hotel stays for individuals or families that might be fleeing domestic violence. Maybe there aren't shelter beds available right at the moment. So we do have the ability to put folks up in temporary hotels until we can find them a more safe and stable place to move on to. So our street outreach program, in a nutshell, this is how it works. There's internal and external folks that are referring into this program. And so that could be individuals who are members of the public. It could be individuals who work for the city or municipalities and the libraries, resource centers, CAP offices. We also work with our internal departments, Department of Transportation, our flood control, Maricopa County Sheriff's Office, and as well as our heat relief network. I know I know that's come to an end as of recent, but we do work with them as well. And as well as members of the public, meaning that, you know, if someone's driving down the road and they see somebody on a bus stop, or they see somebody on the side of the street that might be experiencing homelessness, maybe they talk to them, maybe they don't, but they do see that they need some assistance. We have the ability for those individuals to utilize our referral system, which is as simple as a QR code on their phone, and then they can send those referrals in. Once those referrals are funneled into our system, those come to me, as well as our nonprofit partners, Community Bridges and Phoenix Rescue Mission. So based on the jurisdictional, or based on where they're coming from, right, where the referrals are located, each provider has their own cities that they're responding to. So our portal allows for those referrals to go to the appropriate provider, and that's where we respond to those referrals within those 24 hours. And some of those referrals look like encampment support, right? We do a lot of work down in the Hour Free Awash. We work in canals, river bottoms, things like that. And so sometimes folks will set up camps in those areas, or just areas on the side of the street or in the desert. And so some of those referrals can be for support on those, not only engaging with the individuals who are utilizing the encampment, but also working to clean up the area, right? Because there's a lot of folks in the area that will see it, or, you know, they'll complain about it. My child goes to school, I can see it from my house. So there's a lot of things going on there. So we do want to provide that support to members of the public. And then also we work with Cary Environmental Services, who assist us in doing those cleanups. So we're doing them safely, and we're storing people's belongings appropriately. We're not throwing things away, and what have you. Additionally, the street outreach component, that's the biggest component, right? We're focused on individuals who are unsheltered, living in places not meant for human habitation. And that's the bulk of our service, right? Is we want to go out, meet people where they are, understand what their barriers are, and first and foremost, get them off the street into more safe and livable environments. And then the third component is the flexible funding, which I talked about earlier. So we do have an amount of up to $3,200 per person or per family, like I mentioned earlier, and those can go towards things like deposit, moving costs, or even arrears in some instances. So who is eligible for services? Anyone who's primarily staying outside in their vehicle, living in a shelter, that's our target population. Now we do focus on, as I said earlier, those communities. So if somebody is staying in their vehicle outside or in a shelter in outside of our service area, unfortunately, we can't assist those individuals. But the services that we do offer folks, first and foremost, always hygiene kits, heat relief necessities if needed. We try to get folks, you know, resources for their pets. And then referrals can also be made to outside resources. So we do that. We'll help folks get on food stamps. We'll get folks set up with access, or, you know, mental health services, whatever the service is. We either use an internal service or we're referring out to an external resource. We can also provide transportation to those appointments. So if folks are like, hey, I'm all the way out here in Peoria or Surprise and there aren't any buses and I need to go to Phoenix, we can transport folks to those appointments as well. And then lastly, our flexible funding. I know I talked a lot about this. I kind of chopped it up throughout the presentation, but so we're really focused on individuals who have exhausted all of their means to get their needs met, right? We've tried this, we've tried that, and it's not working. This is my last resort. So we really want to hold those monies towards individuals that don't have access to other services and or other resources for that need. If we identify that, hey, I've exhausted all the resources and I'm still in need of this service, that's where our flexible funding comes in. We will verify that, you know, income information. We do require a W-9 state ID, the valid state ID, and then, you know, documents supporting the amount of money in which we are providing to the household or the individual. The flex funding assistance should result in individuals entering housing or remaining in housing, right? So that's our focus. And then individuals who we are assisting are at or below 80% AMI or area median income. Outside of that, we would refer them elsewhere, or but we are really focused on individuals who income is real low and they don't have the means to meet the need anywhere else. I think, and these are just talking about just the different types of documentation we do require. An invoice, a bill from SRP, APS, you know, a rent ledger, a moving cost sheet that really breaks down the cost in which the client needs. And then any other kind of documentation that supports the move-in cost or security deposits or utility assistance.
I should say too, you can keep it where you're at on the slides, but for the documentation and the collection of documents, it's not an expectation that whoever is making the referral is collecting those documents. That's what's happening on the back end after you've made the referral. So once it gets handed off to CBI or Phoenix Rescue Mission, they're doing a lot of that document collection. So just specifying in case that's a
Yeah,
question.
that's a good specification. Yeah, because we do take that burden off of anybody who refers them in, right? Our providers are going to work to get those documents that are needed. This right here, this is my contact information. This is also we do have these small cards that we'll hand out to folks. It'll basically have just a little blurb about what Hand in Hand is. It has my contact information, but then it also has that QR code that I talked about in order to get to the referral. So you can point your cameras at that QR code, click on that link, and it'll bring you directly to our referral form. We are in the process of working on improving that, but right now it's pretty straightforward, and that's our goal, is to keep it really easy, straightforward, so folks can get the information in and they can get to our outreach team as soon as possible. You can also just Google Maricopa County Hand in Hand, and we are the first thing that pops up. So if you ever don't have the QR code, really easy to find us on the web. But when you do scan that QR code, it will bounce you over to our referral system and you can get started and submit. I think the next slide does show our, yes, beautiful. So if you did go online and you just typed in Maricopa County Hand in Hand, this will pop up, and you click on this. This will also take you to where you can initiate that request. So if you don't have that QR code, you can click on that link and it'll take you right to the referral page as well. It also gives some information about our program, what services we offer, and above that, where it got cut off a little bit, is just kind of that blurb about the areas that we serve. And that is all I have.
Right. Thank you so much, KateLynn and Gina. We're going to hold on questions and move over to our speakers from CAS. So Nathan and Brittnie, hand it right over to you. Thank you.
Excellent. Thank you very much. And Gina, that's not only a great presentation, but really, I know firsthand, a great program. And if you don't know Gina well, there's nobody better to be overseeing this kind of street outreach work out in our community. So shout out Hand in Hand, you too, Gina. That's great work.
Thank you.
And we're here from representing Central Arizona Shelter Services. That's our government name. Everybody knows us as CAS. So Brittnie and I are just going to kind of give you all just an overview of homelessness, the world that we're working in. You can skip to the next slide if you want. Just the world that we're working in, excuse me. A little bit about what CAS does, and then we want to drill in specifically into the work that CAS does in advancing health via partnerships that we have with community providers. And so when you leave today, that's what we hope you take away from us is, some of what the special needs for our population are and what CAS is doing in that regard. So just taking a quick step back and looking at, in a broad brush stroke, the context of homelessness in Maricopa County, at least going back to 2018. Nothing really spectacular for me to say on this slide, except, as you can tell, the numbers have continued to go up year over year over year. And if you see a spike in there, that I can talk about that later, that's related to a data change at one point in October 2023 to make the data more accurate. So when you look at those high numbers, you're really seeing a much more accurate picture of people who are actively homeless in Maricopa County. Looking at that bottom picture, I would highlight a couple of subpopulations that I think are very important. One in the green are the chronically homeless individuals that we're seeing in our community. Those are people who, by definition, have been homeless a long time or are homeless frequently and have a disabling condition, meaning those are highly vulnerable populations that usually have an immense amount of physical and behavioral health needs. And then secondly, I'd also point to elderly. Now, the line is less dramatic, but it's because the number started lower. And if you look at really just the percentage increase, it's also a substantial increase in that subpopulation. Again, the elderly, the yellow line there, people who've been experiencing homelessness that are 62 and over. Next slide. And again, drilling into a bit more about the medical vulnerabilities and the behavioral health vulnerabilities of our population. If you look at from the point in time count in 2024, 23% of the people who were counted during that count were chronically homeless. 14% of them were severely mentally ill, and 14% had a chronic substance abuse. In other words, the kinds of people who quite frequently interact with our community's health services.
So what does that mean for those individuals when they're trying to access services? So one of the things that we really see is that there is just a lack of appropriate services for those individuals. We also see that occasionally they may be avoiding entering shelters. That could be because of past trauma, safety concerns, or even environmental factors like lighting and noise in a communal space. Sometimes individuals are also denied entry to services because some shelters are not equipped to accommodate individuals with disabilities or needing assistive devices. And even then, other programs might not be able to accommodate those with active substance use or prescribed medications like methadone because there's nowhere secure to lock it up. So if we have a lack of skilled services to discharge people from hospitals and shelters aren't an option, where do you go? What do you do? So the health disparities experienced by this population also compound this issue. So research shows that homeless adults have a body age up to 20 years older than their housed peers. So imagine being 50, but physiologically functioning closer to someone in their 70s. We also see extremely high rates of depression and cognitive impairment and anxiety, which can complicate everything from medication adherence to accessing services. And then when you are able to access healthcare, what do you do when you can't pay your copays or your deductibles for those appointments? So the result is a population facing accelerated aging, higher disease burden, and fragmented access to care. Another layer of complexity is added on by the economic instability of this population. So many of our clients are underemployed or unemployed and living on fixed incomes like SSI or SDI. And signing up for these benefits is rarely simple. 67% of applications are denied overall for the first time. And then recent changes to the application process and the reduction in funding for the supportive services that can help people apply for those benefits is just going to further increase the difficulty of accessing those things.
Enter CATS. That's where we, among others, including the Hand in Hand program and so many of our community providers, come in to work in that very complex homeless and intersecting health issue. And so for us, at CAS, one of the things that I'm proudest of is our vision statement. We see ourselves as a cog in a wheel in which ultimately everyone in our community has a home. And going to the next slide, we offer 3 major interventions toward that end. Again, it's important to know that CAS, among most importantly and at core, is an emergency shelter provider. And we're best known for what I would consider our flagship program, the single adult shelter on the Keys to Change campus down in the downtown Phoenix area. There we have 600 beds for individuals in a congregate setting. So it is the largest shelter for single adults across the state of Arizona. And again, it's a congregate setting serving men, women, and people across the gender spectrum. And we also have a family shelter. We are actually got the second largest family shelter in Maricopa County. We have 30 apartment units that we've converted into emergency shelter. There's some double rooms and some single rooms, but we've got 30 of those rooms. We use 26 of them for a program that lasts up to 6 months for people making a longer, more challenging transition out of homelessness for those families. And then we have 4 crisis units with 7-day stays where people can come in, get served, and then moved on more quickly. And then finally, we opened in December of 2024, The Haven, and that serves people who are 55 years and older, many of whom have a whole bunch of the healthcare complications that Brittnie was describing a bit ago. And so we've got 130 units there. Some of them are double units, so every now and again we'll have more people than 130 staying there. And again, we opened that in December 2024. Now, all of those have a combination of our internally provided supportive services, case management, the service that we use to navigate people to the world of solutions that exist for them out there, and the partnerships that we have that round out the whole package, which Brittnie will describe in greater detail shortly. Now, we use a framework, the 8 dimensions of wellness. There are a lot of terms out there. I think commonly we're used to using social determinants of health, quality of life indicators. The SAMHSA's put out an 8 dimensions of wellness tool, and you can break this down and use it in a whole bunch of different ways. I think for us, what's important here is that it really highlights everything that goes into what it means to be healthy. So when people come to a shelter, the idea isn't necessarily strictly just to make sure that they have a place to stay, that they can get across campus and get food, that they can get to a shower. Those things are important, but they are not the whole story of what it takes to become healthy holistically. So we want to build our programs according to this model that you see on the screen here, where whether it's through ourselves directly and very much more often and very importantly, through the partnerships that we create, we want to provide, again, a holistic health experience for the people staying in our shelters that matches this 8 dimensions of wellness tool that you see here on the screen.
So like Nathan mentioned, partnerships are kind of the backbone of everything we do to help our clients overcome those structural barriers to their health and their independence. So one of the first things we realized we needed to address was that connection to benefits. So we created partnerships with DES on the spot and independent Medicare brokers to help with benefits enrollments. So some of you who may be familiar with the Key campus might know that those similar partnerships kind of existed for a while, and we kind of mirrored that process at the rest of our locations to make sure that our clients, no matter where they were staying, had access to that. We also work directly with Keys to Change for connection to their SOAR specialists to come in and connect our clients to disability income. Then we also partner with a variety of agencies, primarily, as you can see, universities, to provide health education to our clients. So with ASU, we get some nursing students who come in and do general health education for chronic illnesses, how to check your feet for anything related to diabetes symptoms, things like that. At our single adult shelter, we partner with Circle the City, who comes in and does an Ask a Nurse session. So she's with us multiple times a month, and she basically covers any topics clients can suggest them of things that they're curious about, or if it's flu season, there's education on vaccinations and how to access those things. Midwestern supplies us with occupational therapy students who come in and kind of provide education on anything that those other 2 providers haven't provided education on. And then one of our sort of exciting partnerships that is relatively new to us is the Institute for Digital Inclusion and Acceleration, or IDIA, who came to us actually as part of grant funding that they received from the county, yay, to provide us with some iPads for our senior clients to be educated on telehealth services. And so not only connecting directly to their medical providers that way, but also how do I access my patient portal? Now that everything has sort of gone digital, some of our clients get left behind. And so we use these partnerships to help fill the gaps.
All right, wonderful. Thank you so much, Nathan and Brittnie. And we're just going to bring down the slides and work towards facilitated conversation. I think just the passion and the insights that all four of you shared are so impactful. Looks like in our questions, we just had one question from an attendee about, are there ways that agencies can request the small flyers, KateLynn and Gina, around the flyers or handouts, cards that they can hand out to patients and organizations? And maybe if so, we can share those via our email.
Yeah, definitely. So you'll have the slide deck with the QR code included, and you can find it on our website, but we can also get you a stack of the business cards. We've got little business cards that we can hand out. So we'll just have to work with Carla to get those in the hands of whoever is looking for them. So yeah.
Wonderful. Feel free to keep and add more questions to Q&A. I'll start with additional ones. So you all shared so many of the different ways and the impacts, but how do you see, or what role can community partners provide input and additional collaboration in helping shape new programs or in strengthening programs that you have that are existing?
I suppose Gina, you warming up? I can start. You're on mute, so I guess I'll just keep going.
Oh, Gina, you're on mute.
Yeah, you are.
Dang mute button. Yes, I was just gonna say the education piece and just letting folks know that we exist. And that's, for us, that's the biggest thing.
Yeah, and on the CAS side, I think for us, one of the things I would do is, to take a look at when you see the 8 dimensions of wellness slide, for instance. Is there a place in there where you fit? We are not healthcare providers, nor are we providers of all of the things on that wheel, and we never intend to be, we never will be. So we're going to rely on people like you to find yourself somewhere in that wheel and say, hey, we know that we can offer something to the people staying down in any of the CAS facilities. And then after that, it's just a matter of reach out, come down, we'll give you a tour. We'll talk more about the program, what we do, what you do, and then we'll figure out how we fit together. But yeah, I would say just take a look at where you might fit in and reach out to us.
How do you all see different challenges in building trust with the engagement numbers, Gina, that you shared, and with potentially chronic homelessness that was shared by Brittnie and Nathan? How does trust look, and how do you help to improve that, shape that, and be that stability to gain that trust?
Sure. So trust building, rapport building is huge. It's literally the single most important thing, component for homeless street outreach. So I would say, honestly, doing what you say you're going to do and following through, that has the biggest impact, because there's nothing worse than being told, a provider telling a client, I can help you, I'll come back tomorrow, we can do these things, and then they no show on that person. That breaks the trust, that breaks the rapport. That's a lot of the reasons why some of these folks that we are working with are in river bottoms, are in places that they don't want to be found. Bridges were burned, they weren't treated they were treated a certain type of way, and they're trying to get away from that, and so do what you say, do what you say you're going to do, follow through. That's the biggest thing for homeless street outreach and building that rapport and trust with folks.
And I would say with CAS, we do similarly, but we also try to avoid being a roadblock to anything. So we function from a no wrong door standpoint. And so we try really hard to make sure that a no is not something that we're saying to clients, unless it absolutely is just something that is obviously not available. But we try to make sure that we are then connecting to the person who could potentially say yes. And so we just try to kind of make sure that that happens so that there's just again, sort of that rapport building and continued engagement and kind of try to repair any damage that had previously been done.
I also just want to add to just making it like verbally apparent to folks that this is like, it's a judgment-free zone. We're not judging you no matter where you're at, what's going on in your life. That's really important too. Judgment-free zone, safe space. We want to help folks.
Wonderful. For the shelters that at CAS or other shelters that might be maybe, let's say, in the Maricopa County area, can you speak to maybe restrictions or components of where there can be allowances for pets and what different accommodations and what that looks like?
So yeah, there are obviously all facilities are required to accept service animals, and a lot have expanded to accepting emotional support animals with what people would consider appropriate documentation. So would be that letter. Any animal though that is accessing services needs to have typically a license and or a rabies vaccine. So since the license is sort of the second step after receiving a rabies vaccine, most of the time that's sort of the bare minimum floor there. And so sometimes there are obviously barriers connecting individuals to the veterinary services that are required to be able to get those vaccinations. And then actually within the facility, obviously in congregate settings, that can be somewhat difficult if you have animals that do not get along with each other, or you have clients who may have allergies. And so it's sort of navigating those things. There are a lot of providers out there, though, who are really realizing that needing to kind of cross that space into animal welfare is also a big component of human services. And so there's AZ Pet Project in the community, Companion Pets in Crisis, Lost Our Home, who are really interested in helping shelters and service providers kind of figure out how to make it work. So they, when funding is available, help with things like muzzles or crates or other ways that we can kind of cohabitate in the same space. So there's progress being made for sure in that space.
Only thing I'll add that we have across the shelters, first of all, we very much pride ourselves on being as low barrier as humanly possible with no intent to change that. There's got to be a way for the people that Gina and those teams at Phoenix Rescue Mission and CBI are finding in those washes who otherwise may not get into so many places, have a place to go. And that is very often CAS. Couple of exceptions are sex offenders. We're unable to take sex offenders. That's one of the things that we face. And then at our family shelter, the bedrooms are upstairs. So you got to be able to get upstairs. Other than that, man, we're taking basically whoever.
Thank you for pointing that out, Nathan, because that is so very important. Because I mean, the first thing we're going to do with folks that are unsheltered is ask them, you want to go into a shelter, right? Do you want a shelter bed? And a lot of the unsheltered population will have pets. So it's been a breath of fresh air and being able to work with you guys more fluidly on that. And then also all those resources that Brittnie was talking about, our street outreach team will work, transport, help, sometime even financially assist with some of those barriers. So if it's, hey, we need your pet registered in order to come into the shelter, let's go take that client, let's get that handled, let's remove that barrier and then get them over to the shelter. So having that availability of shelter beds is so helpful.
Appreciate that in terms of the reducing of the barriers and challenges and acceptance. For Nathan and Brittnie, with the Haven coming on its 1-year anniversary there, what are kind of some lessons learned and some advice that you'd give to communities who may be looking to build in that similar type of approach and model?
Brittnie, why don't you start with the lessons learned and I'll maybe share a little advice.
So I'm hoping that it won't be quite as applicable in future programs, but we were coming off of the COVID hotel situations. And so a lot of those were still functioning hotels with rented rooms for the use of shelter programs. And so there are certain amenities that sometimes come with an active hotel that do not necessarily come with a shelter program. And so just kind of making sure clients were pre-educated on sort of the fact that, yes, this is a fully functioning shelter and it can kind of be what you're expecting from that. So hopefully not applicable for everyone else, but is something that we kind of learned. Another thing is that the just having a private space, especially for adults who are facing medical concerns, might need to use sanitary napkins, incontinence products. There's a lot more of like restored dignity with that individual space. And so if you have the opportunity to be able to provide non-congregate services, especially for individuals with medical needs, it's a huge sort of boost to that just sense of humanity that I think we kind of forget about. So.
Yeah, one of my favorite stories is we had when I did a like ad hoc sort of listening session, there was a couple of ladies who were staying at the senior haven, and they both were in active cancer treatment, and everybody starts at the downtown 600 bed congregate shelter. Please don't gloss over that. That is a bunch of people in relatively small spaces. And so for them moving from the downtown single adult shelter to the senior haven was helped with their treatment in so many ways that they were in tears describing to me the difference. So I mean, yeah, that's incredible. Advice that I would share is really I would give two things. One, and this is very specific to what CAST did. So we opened a very niche shelter in that we offer something for a subpopulation, and there's nothing else like it in the state. And I can't find anything else like it of its scale in the nation, quite frankly. And so what that means is when, as you looked in December 2024, we had 1,268 people who fit that population experiencing homelessness in Maricopa County alone. You're quickly overrun. Gina's calling, everybody's calling. Can I get somebody in? Can I get them in? And quite frankly, the answer has to be no, except if you follow the right process, because we've got hundreds and hundreds of people that need to get into this place, and we have to honor the person at the top of the list. They've been waiting for a bit, and they're as vulnerable as the 300th person who's trying to get into this thing. So for us,